Next, at the end, the 10th question, they are asking causes of proteinuria. So what is proteinuria? It's nothing but protein in urine. Okay, so proteinuria is nothing but the protein in the urine. Is it normal? Normal if it is less than 150 milligram per day. So when is it abnormal? When it is more than that. Okay, so but there are certain differentiation like microalbuminuria, macroalbuminuria. Okay, so first let's just go through these things. Okay, what are the causes of proteinuria? We have glomerular causes. So here is the glomerulars. What are the causes? We have some examples like nephrotic syndrome, diabetic nephropathy. Nephrotic syndrome, it means proteinuria. Okay, so through the nephron we are losing proteins, so that is nephrotic syndrome. It causes swelling in the body, okay, because of the loss of the protein like albumin mainly, because albumin is the main reason to maintain the osmotic pressure in the blood vessels. So when that is lost through the kidney, so the oncotic pressure will go away, the water will come out from the blood vessels into the interstitium all over the body. Okay, so that was nephrotic syndrome. Then we have diabetic nephropathy. So how does diabetic nephropathy cause proteinuria? So diabetic means there is high blood sugar level, and this high blood sugar level will cause damage to the glomerular basement membrane. Okay, it also increases the viscosity of the blood and pressure in the blood. Okay, so all these things together causes protein to lose through the urine. Done. So glomerular causes, two things done. Then we have tubulo-interstitial causes. What do we mean by that? That means, see, these are all the tubules, PCT, DCT. Okay, so tubulo means these tubules, and then interstitial means the things that are there adjacent to these tubules. Okay, the interstitium. So all together, the inflammation of all this together, these tubules and the adjacent interstitium of the tubules, so any inflammation in that part also can cause proteinuria. Like, what are the causes? Like, there are certain medications which can cause tubulointerstitial diseases. Okay, like penicillin, cephalosporins, then NSAIDs, then any infection, bacterial infection, viral or fungus, or any autoimmune diseases can cause tubulointerstitial disease like SLE, or there is something called as Sjogren's syndrome. Okay, or Sjogren's syndrome. Then any toxins also can cause that. Then we have other causes like hypertension. So high blood pressure, if the blood pressure is severely high, then there will be too much pressure in the glomerulus. Too much pressure means it will lead to, what do you say, it will push the proteins outside from the blood vessels. Okay, too much pressure. Then heart failure also causes proteinuria. So if there is heart failure, so not too much amount of blood is coming into the kidney. So in that case, the kidney will respond by activation of the RAS mechanism, renin, angiotensin, aldosterone system. From there will be vasoconstriction, and more amount of blood will come again into the kidney, into the glomerulus, and again that will cause damage to the nephron. Then again proteinuria. Then infections, UTI, and then pregnancy. And what is preeclampsia? Preeclampsia is nothing but increase in the blood pressure when the mother is in the pregnancy state. Okay, so how much it is? It is like more than 140 systolic and more than 90 diastolic. So that is a range, okay, upon which we can say that okay, she is in preeclampsia. So preeclampsia or pregnancy causes proteinuria. But the thing is, in pregnancy there is usually, like, that is normal only to have little bit of proteinuria, but above that it goes, then that is proteinuria, that comes under significant proteinuria. Okay, so that is there, and these are some normal and abnormal ranges. So normal ranges less than 150 milligram per day of the total, if it is gone through the urine, that is okay, that is normal. If we talk about in terms of albumin, then that is less than 30 milligram per day. Then there is something called as microalbuminuria, that means from the range of 30 to 300 milligram per day albumin. If it is lost, then it suggests that there is some early kidney manifestations, okay, some early damages in the kidney, or maybe there is hypertension, okay. So that is microalbuminuria. Then we have macroalbuminuria, which is greater than 300 milligram per day of the albumin or more than 150 milligram of the total protein. Okay, this suggests significant kidney damage or maybe any kidney pathology. Then we have nephrotic range proteinuria, that is like more than 3.5 grams per day. Okay, that indicates severe glomerular injury. Done. So these are the causes for the proteinuria for 3 marks. Okay.